Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate personalized care for individuals and families throughout the Berkshires and also in the hill towns of Hamden and Hampton counties, all in the comfort of their own home. And today, it's about that time of year where people have to be concerned about the flu. And so there are a lot of flu clinics out there. There are signs that you see on the sides of the highway. Well, we want to say that probably the best place to go is going to be with Porchlight VNA and Home Care. So I'm very happy to welcome to the program two people who are very much involved in the flu clinics with Porchlight. Karen Farkas, who is the public health nurse for Porchlight VNA and Home Care. She's a registered nurse. And also Shannon Smith, who is the senior biller for Porchlight. So both of you, welcome to the show. It's great to have you.
Thank you, John.
And it is. It's something that people, every year, well, who has the flu shots? Where are the clinics? What is the flu shot like this year? How is it different than last year? And that sort of thing. So, Karen, you're getting all these questions right now. So,
Yeah.
so how is it this year? As far as the concern, what is the flu like? And I know all that comes from the big public health behemoth that we have here.
Yeah.
So what are we hearing this year?
Well, this year is, it's flu season, starting, it could be flu season anytime starting now through next spring. This year, they don't really know yet because there is no real flu out yet. It hasn't emerged yet. Certainly not in any great mass. Usually the flu peaks in around January or so, but what the manufacturers do in creating vaccines is they try their best educated guess to predict what the flu strains will be in any given year. And then they start manufacturing them, spring, summer, so that we all have flu vaccine by end of August, beginning of September to start administering the flu.
Does it ever
vaccine.
change throughout the year? In other words, do we adapt the vaccine or the not the vaccine but the flu shot if we have a season that is perhaps different than we anticipated?
I don't believe so, and I don't think they can't they can't make flu vaccine overnight. I mean, it's a process.
Right.
I do remember a couple of years ago, though, maybe more than a couple of years ago, where the H1N1 was the big flu. And in addition to the regular flu vaccine, the standard flu vaccine, we had to get a second shot. I don't know if you remember that. Everybody was getting the regular standard flu vaccine, which was 3 or 4 strains of flu that they predicted, plus the H1N1, which was the outbreak that year. This year, the flu vaccine contains, one of the strains that it contains is that H1N1, so it's all in. And it was the last couple of years, too, as well.
Makes a lot of sense. And so just so we get the information out there immediately, so people know where they can get their flu shots and so forth, as we talk more about what the flu is and that sort of thing. How can people learn more? Where will there be clinics, and how do people sign up for it?
Well, the clinics are all over Berkshire County and the counties that you mentioned. We cover, Porchlight covers all of those areas. We have freestanding clinics open to the public. We go into the schools. We have homebound people who can't get out to us to get a flu vaccine if they're disabled or elderly and they can't get to us or to a clinic. They can call our office and we will go out to them. Or they can drop by our office during office hours. It's best to call ahead to make sure that there's somebody there who could administer the vaccine, but they can come to our office and get the flu vaccine as well.
And so there should be also information on the website, Porchlight Home Care.
There is a call, and we have a number of clinics still to go, and I think we have a health fair in November that people can attend as well.
Okay, and so people,
that's open.
Right, so
to
people
the
will
public.
be hearing about that. So and then interestingly, the question is, who is eligible, who's able to get a shot, and that sort of thing. So that goes to Shannon, senior billing specialist with Porchlight. So tell me about that process, how someone pays for a flu shot or doesn't.
With healthcare reform, The state of Massachusetts decided that everybody deserves to get a flu shot and not have any out-of-pocket cost. So everybody's eligible to get it, all ages. And we just require that you bring your insurance cards with you. We obtain 2 different kinds of vaccine, purchased vaccine that we pay for out of pocket that we will get reimbursed for by the insurance companies for administering it and for the vaccination itself. And then we get vaccine from the state of Massachusetts. And so people who are deemed underinsured, their insurance won't cover the payment of the vaccine, they get a free flu shot, basically. Their insurance won't pay for it, so the state covers it. Children also are available to get state vaccinations, so there's no out-of-pocket cost for them. So it's actually really nice. And
So either way, someone is not going to be turned away
No.
For a flu shot. And I think that is something in public health that makes a lot of sense, because we recognize that, whether you have insurance or not, and one day we won't have to ever worry about this issue, I know.
We hope.
We hope, with the kind of reform everyone wants to see. But looking at that, in this case, Massachusetts has recognized that no matter what, it benefits us all
Yes.
if everyone has the flu shot.
yeah, again, we just ask that they bring their insurance card. That way we know what kind of vaccine to give them and how we are going to get our reimbursement, whatever that is.
So on the clinical side of things, those are 2 different vaccines, Karen?
It's the same vaccine.
It's the same vaccine.
It's the same
Okay.
vaccine.
It's just one has a
comes
label from the state of
2
Commonwealth of
different
Massachusetts.
pots.
Okay,
Exactly.
okay. It wasn't-
It's
Sure.
exactly the same composition. It has 2 different serial numbers or stock numbers because it comes from 2 different sources, but it's the same manufacturer, the same good stuff in it.
Right. And, looking at that, the flu, so taking a step back, what exactly is the flu? We hear about strains and different strains and that sort of thing. What is the definition of the
Flu is influenza, is the long name for it, and flu is a contagious respiratory illness that affects the nose, throat, and lungs. It can go from being very mild to being quite severe, and even can cause death. And that's why we're so proactive with vaccine, because people in this day and age still die from the flu, believe it or not. So it's spread very easily. It's spread by droplet. In other words, it's a moist droplet. When somebody coughs or sneezes, it just spreads that virus out. In fact, if you're sitting in the back of a movie theater and sneeze, those droplets can go as far as the front of the movie theater. That's how far out it reaches. So it spreads by droplet. It gets picked up by somebody's nose or mouth, and they breathe it in, and they can become infected by this virus. It's also, in some degree, if you cough or sneeze and it lands on a solid surface, for a while it can stay alive, and somebody else can pick it up, and then if they touch their nose or their mouth, they can be infected with the virus. Like a telephone, if you use a phone after somebody that's been infected, they can be infected with that. And people who have the flu can be not yet showing symptoms, but they can be contagious for as long as a day before. So they may be feeling like they're coming down with something and be contagious at that point, and then they can be contagious up to 7 days after
they feel
feel
and
okay.
I think that's a great point that you make, because often you hear from people, oh yeah, I felt terrible, I had the flu, oh, but I feel better, that was a couple days ago, I'm fine, which you may be fine. You may feel great, but you raise a good point to say that it doesn't mean you're still not contagious. And I think that's a great misinterpretation that people have who are not in the clinical world, which then leads to the continuation of spreading the flu or any kind of cold or whatever.
Yeah, and it can last a long time. I mean, I saw people yesterday in our clinic that we had yesterday, and the man said, oh my God, I just felt like I wanted to die. It was so bad. And he said it lasted over a week. You know, he had severe symptoms for over a week.
Right.
You
I
know,
mean,
and he was an elderly guy.
yeah,
so
and
he
when you
was more at
and when you
risk.
have the flu, real serious flu, I mean, getting out of bed is quite an effort.
Well, that's one of the biggest
right.
symptoms is fatigue.
Right.
I mean, people can have fever, and not everyone has a fever. Cough, sneezing, runny nose, headache. The body aches are what kind of sets it apart from a regular cold or other virus.
Right.
Is those terrible, terrible body aches. And yeah, not everybody gets the fever, so people think that, oh, well, it wasn't the flu because, you know, I didn't have a fever, but,
Right.
you know, some people escape that. And nausea, vomiting, and diarrhea, adults can experience that, but that's mostly children
Mostly
get that
children.
with the flu.
Right. So it can be a combination of those things, but some people may not have all
Right,
of those
right.
things, like the fever. But like you said, the telltale sign is that you're having those body
Yeah, the
aches,
body
which you
aches
wouldn't
are-
get with a normal cold.
Yes, exactly.
Yeah.
Exactly. It does mimic a cold a lot, especially if it's a mild flu. You know, people just think they had a cold. But most people, you know, that I've talked to that have had the flu, it's a terrible experience.
Right, right. And Shannon, I know you've done this for several years as a part of these clinics. You know, how important and how significant is it for us to be able to provide this service to the community?
Greatly. I mean, it's so important to be proactive with your health and to take all precautions to not get sick. And so, you know, when the state offers you a vaccination to help prevent that illness, you should definitely take advantage of it.
Yeah, you got to take it. And it's of course best practices. I know there are some people out there, and this is a good question for you, Karen, who would say, well, you know, if I take the vaccine, it's going to weaken my immunity because, you know, maybe, you know, I haven't had it for a few years and so, or whatever. People have all kinds of ideas about what that means. So what would you say to someone who would suggest, well, I'm better off not taking it, or in the past, maybe I got under the weather after having a flu shot.
That's
so
a
they're
very
afraid.
common.
That's probably more
That
common.
is very common.
Yeah.
A lot of people have this misconception that, oh, when I get the flu shot, I get the flu. Well, first of all, it's an inactive vaccine. So there's no live vaccine, at least in the standard one. In the nasal one, it's live, but we could talk about that in a minute. So there is no actual flu in the flu vaccine. So I tell people, you know, that was a coincidence. You were probably getting ill, you got the vaccine, and then you got sick, you know. So I do encourage people. I mean, in my view, everyone should be vaccinated.
Yeah, and you're hearing more about that nasal entry vaccination. So what is the difference between the traditional shot and then
Right.
this
well,
nasal?
the difference is the standard vaccine is usually 3 strains or 4 strains, which, you know, that's a standard type, and you get that via an injection. Most people get that. Anyone over and that's recommended for everybody age 2 and over. There is an egg-free vaccine that's available to those that have an allergy to eggs, because the standard vaccine is cultured in an egg bath, or however they manufacture it, but anyone who has an allergy to eggs should not get the standard vaccine. Those with severe allergies to eggs would check with their physician whether they should even be vaccinated or not. Perhaps the physician may just say, no, you know, no vaccine for you. That's why everybody else should be vaccinated, to protect those people who can't get it. But that could be given to somebody who has a mild or moderate allergy to eggs. Then there's this high dose. That's one other thing I wanted to speak to, because a lot of people ask me about this high dose vaccine. It is available, and according to the CDC, people do mount a higher antibody level to this vaccine when compared to the standard vaccine. However, the data has not panned out to show that it's more effective with the higher antibody level.
So that's a good point. So what does the vaccine actually do to your body to protect against the flu?
Well, that's a good question. vaccine, whether it's flu vaccine or a chickenpox vaccine or a measles vaccine or polio, any vaccine that you get, it's administered, it gets taken up by your bloodstream, and your body, through its immune system, makes antibody. It's exposed to this. In some cases, it's a live vaccine. In this case, it's not. But it's exposed to this vaccine, and these antibodies are being formed to protect you for a brief period of time, like with the flu. Flu vaccine only lasts for about 6 months, or lifetime immunity, like a measles or mumps vaccine. And the idea is that your body has these antibodies floating around, and sometimes for life, and can protect you from the illness the next time.
Right.
So those two types of vaccines, you're getting a higher antibody, you're mounting a higher antibody response with that high dose vaccine. But so far, according to the CDC, there's no data to show that it's more effective. You know, it just hasn't panned out yet. And then the last type of vaccine is the nasal vaccine, which is a popular one with children, you know, because they don't have to get the needle, the injection.
Right.
It's inhaled. It's administered in the nose and then inhaled. But that can only be, that's only recommended for people age 2 to age 49. And it's recommended for healthy individuals. It cannot be taken by anyone who is immunosuppressed because it's a live vaccine. So anyone immunosuppressed can have it.
Right. To show risk.
It's not recommended for pregnant women. And it's not recommended for people who are at that higher risk of getting flu or having sequela of the flu, like elderly. They may get the flu, but they may get pneumonia on top of it. So anybody who's very, very young or very, very old are more at risk. People who have comorbid illnesses such as diabetes, bad heart disease, bad lung disease, those people should not get the nasal vaccine. Healthcare workers can get it, but healthcare workers that work with immunosuppressed people should not get it. They should get the standard type, which is not a live vaccine.
So looking at that now, you know, having the vaccine builds up your immunity so that, you know, if you come into contact with the flu, the virus, then you're able to fight it off. But the ideal thing, of course, is to not ever have to deal with having the flu enter your system. And there are a lot of ways that we can insure ourselves, or better insure anyway, because there's no way to fully insure
the prevention.
to prevent it. But so let's talk about that a little bit. I think, you know, the basic one is washing your hands and not touching your face.
Exactly. That's
You know?
it. I mean, first and foremost, you know, as I said before, in my view, everyone should be vaccinated. But those that can't, children under the age of 6 months can't be vaccinated. So caregivers and parents of children under the age of 6 months should be vaccinated because they're dealing with somebody who cannot get the vaccine and can't protect themselves. But other than the vaccine, good hygiene is the best way to prevent flu and any other illness. You know, that's your best thing. Hand washing is the number one, or using the hand gel. Hand gel does kill flu virus.
It is. I think there was some discussion about that. You know, what's more effective, washing the hands, you know, for a certain period of time.
Gold standard.
Or that's the gold standard. But I think it's been shown also that the hand gel is you know, very effective. You know, especially, you know, read the label, make sure that, you know, that it's the good stuff. I don't know, you know, if you recommend any particular brand or what have you, but as long as it says 99% effective against killing everything, then
it does.
Then
I mean, there's very few
good.
bacteria that are not susceptible to the hand gel, and most healthcare providers would know that. But hand gel, don't put things in your mouth like your pen or paper clips, or, you know, if you use especially the telephone, that's in a public area that a lot of people are using it. Handrails, elevator buttons, doorknobs, you know, things like that. wash your hands, wash,
Yeah.
wash, wash.
Yeah, and you know, during this time, we make a lot of you know, everyone feels like they have OCD, but you know, that's the way you have to protect yourself,
Yeah.
because we know so much more about how the virus goes from one person to
Right.
another, and even the sort of airborne scenario that you talked about. So when you are sneezing,
Right,
or you
this.
know, exactly, and then not to sneeze in your hand, to sneeze into your elbow area as best practices,
Or a tissue or something
or
other
having
than your hand.
or something like that. But then
Yeah.
throw that tissue away.
Yeah.
Don't leave it in your
Or
pocket.
don't loan it
You
to
know,
somebody.
what about handkerchiefs? I
Yeah.
mean, those are like really probably
germ
people shouldn't be using handkerchiefs.
filled.
Anyway, it's so gross. But
I
anyway.
think they went the way of hats, you know,
They
men's
went
hats.
exactly. So Shannon, I know you follow all of that.
Yes.
You're you know, being around it so much. So tell me about your role a little bit, aside from you know what you do with the clinics, but because your role is so important in this nonprofit organization, you know, making sure that all the numbers work, so you can continue doing the great work that's being done.
For the flu season, I coordinate all the clinics in all the towns. We also do business clinics. We send out reminders to all the local businesses and remind them that
I
it's
see.
more beneficial to them to help vaccinate their employees than have them get sick. And we go into some of the businesses. They pay us to go in and administer the vaccine to them, which is wonderful. So I coordinate with each location when they want to have their clinics and get them on the calendar, and I schedule out the nurses to go out and clerks, because it's important that the paperwork is done properly so we can get reimbursed. And we work with Berkshire Community College. We have student nurses who come down who help out at our clinics also.
Right.
So
So
I-
is this available to all businesses in Berkshire County and
Yes.
throughout the
Yep. If they're
Hampden and
interested, they
Hampshire
should call
County?
us
Yeah.
and we can go in. And we do it around their schedule, whatever's convenient for them. They have options, morning, afternoon, and evening, and what day of the week works for them.
Yeah.
So
that's really important, and I think you know it goes back to one of those classic stories, Karen. You know, when someone is sick and they have the flu, you know, should I go into work or should I not go into work? Well, the
Stay
answer
home.
is stay
Yeah,
home.
right, exactly.
All right, you know, because it's not about being a hero or you know, or being a martyr or whatever. You know, you are hurting other people by going into work. So there's another little tip for
Yeah. Well,
don't go into work. Yeah.
we've gone into a number of businesses, and they are so grateful that we go to them. Then this way they don't have to take time off of work to go. They don't have to think about it.
Yeah.
They sign up, we go in, it takes an hour, we can vaccinate 15, 20
Yeah.
or more in an hour, and it's great.
I know, having worked in healthcare for several years, it's always been very convenient having nurses all around who are doing that during this time of year, and that is a good thing. So if we can bring
Yeah.
that sort of you know, concept to other businesses, so you know, because again, it's like you
Yeah.
said, you see the signs out there, you know,
Right.
at the grocery stores or whatever, but you really want, you know, you want to feel
Right.
good that your nonprofit, you know, agency, Porchlight is doing it, and then also being convenient and going into
Right,
those
right.
businesses. We have a lot of banks, we have a lot of, you know, these larger
Yeah,
organizations that have 50
Like
or 100
lawyers'
employees.
offices,
Yeah,
accounting, but
exactly.
even schools. I mean, we'll go
schools.
in and immunize the teachers and the students, and you know, one visit, two visits, whatever. We can go out and cover the schools as well, so that
Right.
they don't even have to worry about going anywhere.
Again, so then those businesses interested, those schools interested, should call Porchlight.
Yes, they should.
At 413-243-1212. Is that going to be the right number?
Yes, it is.
Okay, and we'll flash that up on the screen right now as well, so people can write that down and call. Again, 243-1212. And Shannon, you're sort of the coordinator for all
they
this.
will get
so,
to me, yes.
She is
So
a
ask-
wonderful coordinator.
So ask for Shannon and of course and Karen from the
Yeah,
clinical side
sure.
of things. It's wonderful to have this as a resource. And again, I think very important, Shannon. I want to, before we tail out on the show, is to make sure that people know that everyone can get a flu shot.
Yes.
That no one is going to be turned away.
Correct, even if they don't have insurance, because we have encountered a lot of people this year who don't have insurance. That state vaccine is meant for them.
Absolutely, which again, you know, Karen, makes a lot of sense.
It does,
Because, you
it
know,
does.
if we
Yeah.
have pockets of individuals in our community who are not able to get the flu shot, then that's defeating the purpose of good
Exactly.
public health.
Exactly. Yeah.
Yeah.
No, it's true. Yeah, I mean, I think more and more people are getting flu shots these days. I mean, I think people are understanding the idea of this, herd immunity, so to speak, where, you get vaccinated and it does protect those that cannot get it. And there are pockets of the population who can't get vaccinated for whatever reason or who choose not to. So the more people that are vaccinated, the more protection for themselves and others, because there'll be less incidence of the disease.
That's fantastic. So once again, the number is 413-243-1212. Get a hold of Shannon, set up those flu shots at your business, and then also for individuals, you can get more information also by calling Shannon and also by seeing Porchlight's website, where I'm sure a lot of that information as far as upcoming clinics will be on there. So which is porchlighthomecare.org. So Shannon Smith and Karen Farkas, a great pleasure having you on the program.
Thank you for having us.
And
Thank you
thank you
so
for
much.
doing this service to the
Thank you.
community. Thank you.
Thank you.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.